Hello everyone, welcome to my channel, HTTP, Health to the People. My name is Sal Aguilar, the founder, and a little bit about myself. I used to be a supplemental instruction leader and tutor for human anatomy at a university that I used to attend as a student. And so what you see here is a presentation of basically my notes that I had put together for my sessions and as a student. And so I'll offer you tips and tricks and help you through the different models and things that you'll encounter. In this case here, we're talking about the knee joints. And as you can see here, I have four different pictures of the same model, the knee joint model. I highly suggest that you do this for yourself. Go into the lab and look at the model for yourself in person. Take your own photos as I have done here. These are all my photos that I took. So I took photos of every view that you could think of the model. So that way, whatever was asked of me, I would be able to identify it. And so that's what we will go over here, all the different views of this particular model. First off, we have the anterior view. So a quick little review. Anterior is the front of the body. So when you look at someone, you're looking at the anterior view. And so here in the knee, just a few quick structures to get oriented, because it is in anatomy, it is always very important to get oriented as far as what directional terms you'll need to use and what specific structures you're seeing. So let's start with this number 10 here. Number 10 here is a bone, this entire bone here. This bone is the femur. So it is the large leg bone. And then down here, we have another bone, which is our tibia. That's number 11. And then over here to the left here on number 12 is the fibula. So knowing these three different bones can help you get oriented as far as what is what. So you'll need to know the directional terms, lateral and medial. First off, on these structures here, this one here and this one here, they're both called collateral. So when you identify those structures, they will both have the word collateral in them. But furthermore, you have to know the directional terms. So if you know your human anatomy, you'll know that the fibula here is on the lateral side of the body, or the outside of the body. And so this one here is on the lateral side. And then on this side of the body is the medial side of the body. So towards the middle or inside of the body is the medial side. And now that we've oriented ourselves, let's also identify a few more of these structures. The first one I want to talk about here is number 7, which is all of this here. That is a particular tendon that attaches to 4 different muscles known as the quadriceps. So because of that, it is called the quadriceps tendon. So those muscles attach to a bone. So we have a muscle attaching to a bone that is called a tendon. Conversely, if we have a bone attaching to another bone, then you have what's called a ligament. Bone attaching to bone is a ligament, and muscle attaching to a bone is called a tendon. So here again, number 7 is the quadriceps tendon. We talked about the directional terms. So here we have the lateral, and this is the medial. They are ligaments, so those are within the words of that. And so actually, in particular, because we are on the lateral side of the body on this one, it is the lateral collateral ligament. Also has a second name. Both will be correct. It could be the lateral collateral ligament, or it could be known as the fibular collateral ligament because it attaches to the fibula. Also on this side, this is the medial side. So this particular ligament is the medial collateral ligament. It attaches bone to bone, just like this one did, but it also attaches to this particular bone, which is called the tibia, right? So it has 2 names as well. It can be known as the medial collateral ligament or the tibial collateral ligament. You'll see where on the next slide where I actually number it, but I just wanted to cover that since we're getting oriented here. Another one that I have numbered here is number 5, which is this pad that goes in between these two bones, the femur and the tibia. So the pad as a whole is the meniscus of the knee. It is made of specifically of fibrocartilage. So if you're ever asked specifically what type of cartilage is made out of, it is made of fibrocartilage. One of the few places that you'll find fibrocartilage. And let's see, the next structure that we can talk about here is number 6. Right behind this area here is a bone, which you will see on the next slide. Underneath there is that bone. It is the patella bone. So your knee, what we think of there is the patella, and it has a ligament attaching here. So what we have here, number 6, from here to here is your patellar ligament, because it is attaching bone to bone. So the patella, that bone, to the tibia, and it is the patellar ligament. Next, we have the medial view of the model. So again, we have to orient ourselves, and this is the patella I was talking about here on the previous slide. And here again is your patellar ligament, and up here is your tendon, the quadriceps tendon. And again, this is your femur bone. And this is the tibia, which is, again, is on the inside or the medial side of the body. So structure number 3 here, we are talking about the medial collateral ligament, or also known as the tibial collateral ligament. Number 4 here is very similar to what we talked about earlier. Number 5, the meniscus of the knee, but because we are on the medial side of the body, then you can actually call this the medial meniscus. So it has a directional term as well, depending on what side of the body you are. So it is the meniscus, but here it is specifically called the medial meniscus because it is on the medial side of the body. Okay, we'll go to the next slide. Now we're looking at the back of the knee, right? So because we are on the back of the knee, we are looking at the posterior view. So again, on the back side of the body, the opposite side of anterior is the posterior view. From the posterior side, we can actually see a couple of structures that we haven't seen before. And we can still see some that we have. So again, we'll orient ourselves. This here is the femur bone. This here is the tibia. This is the fibula. Because the fibula is on the lateral side of the body, we know that this is the lateral and this is the medial side. This, which I numbered here as number 3, as you saw before, this is still the medial collateral ligament or the tibial collateral ligament. But now we can see the opposite side now, and we are on the lateral side of the body. So this is the lateral collateral ligament or the fibular collateral ligament. Fibular because it attaches specifically to the fibula. So again, this is the lateral side of the body. It attaches to the fibula, and it is the lateral collateral ligament or fibular collateral ligament. And again, this side is the medial side, so this is the medial collateral ligament or the tibial collateral ligament. This number 1 here, you saw on the previous slide, and I just forgot to mention that, which was here. But really, it is anywhere where it is a type of cartilage. So it is a type of cartilage that specifically would articulate or touch another bone. That's why it's called articular cartilage. So if it asks what type of cartilage you have here, you can name it as the articular cartilage. If they want to get even more specific and say, well, what type of cartilage is it made of, then you could say it is hyaline cartilage. So the opposite of the type of cartilage that you saw here, the meniscus of the knee, 4 and 5, that was fibrocartilage. The type of cartilage that surrounds the bones themselves would be articular cartilage, or specifically hyaline cartilage. And specifically the meniscus of the knee, which goes across here, but not this structure here. The meniscus of the knee, you can refer to it again directionally. So this number 4 would be the medial meniscus, and the number 5 would be the lateral meniscus. And the two new structures that you see here are number 8 and number 9. So with these, they are called cruciate ligaments. Cruciate because the word cruciate means cross. So they cross each other. One of these, number 8, is more anterior to the other, number 9. Number 9 is more posterior. So that, knowing that directional terms will get you the name of these. And so number 8, it is more anterior. So then you are talking about the anterior cruciate ligament, or otherwise known as ACL, a very highly known injury that you see in sports injuries, ACL tear. Well, this is talking specifically about the one that's anterior to the body, the anterior cruciate ligament. And as I mentioned, this directionally, this is posterior, more posterior compared to that one. Then this is the posterior cruciate ligament. So because they form that X or cross form, then they are called the cruciate ligament. So the anterior, number 8, cruciate ligament, and number 9 is the posterior cruciate ligament. And then one more view, we have the lateral view of the knee. We've already talked about all these structures, but a quick review again. So we have the femur here, we have the tibia, we have the fibula. Again, we do know that because we're seeing the fibula here, it is on the lateral side of the body, on the outside. So then we know automatically what number 2 is. It is the lateral collateral ligament, or fibular collateral ligament. Also, again, directionally, we are on the lateral side. So number 5, this is the meniscus, but specifically, this is the lateral meniscus. The other bone that we see here is the patella and its ligament, which is attaching to the tibia. So we have the patellar ligament. Over here, we have muscles that we don't see, but this is a tendon attaching muscles to bone, and it is the quadriceps tendon. Again, all on the top of the bone here, you would have, which it's not found here on the model, but you could have, in reality, a type of cartilage, which is articular cartilage, again, made up of hyaline cartilage. Same thing on this bone here, because these two bones articulate together, that they have the articular cartilage, which is made up of hyaline cartilage. And that actually covers everything on this model here, and I will go to this last slide that contains every structure that we talked about here. So if you were doing a particular exam in your lab, you would have, just as I numbered these structures, you would have something similar, or maybe stickers placed on these areas. And number 1 here could be a question that says, okay, what kind of cartilage do you have here? We talked about that. That was on top of the bones. And so it was articular cartilage, which was specifically made of hyaline cartilage. And so, again, these are all the answers, and I appreciate you tuning in. And more videos will be following. And I thank you again for visiting HTTP Health to the People. And if you like this video, please like the video and subscribe to the channel. And as I mentioned, there will be many more videos coming. I appreciate you. Thank you.